Hello everyone and welcome to this video on psychoeducation for ERP. This video is meant to be used by mental health professionals who are trying to start a therapeutic process called exposure and response prevention on their clients with OCD. Now, when we are dealing with clients with OCD, we need them to know what their disorder is. We need them to know how it keeps itself going and how ERP can actually help them break free from that loop. So personally, when I am starting ERP with someone, I usually start by telling them about OCD. I don't want them thinking that OCD is just about being overly neat or clean or organized. It's actually a condition where a person gets intrusive, unwanted, repetitive thoughts that we call obsessions. And they feel such intense anxiety that they end up doing something to feel safe or neutralize the thought, actions that we call compulsions. I need them to have a very good understanding between obsessions and compulsions, and they need to know how to categorize their thoughts and behaviors as such. For example, someone might think, what if I didn't lock the door? Someone might break in and my family might get hurt. I will be the one to blame. Now, on the surface, we can think that everybody has thoughts like these at some point or the other, but when people with OCD have these thoughts, it's often accompanied by checking behaviors. So for example, in this case, the person might end up checking lock 10, 15, or even 20 different times. This act of checking can actually reduce anxiety temporarily, but it teaches the brain that I'm only safe as long as I'm checking repetitively. So the next time this thought arises, the brain demands this ritual again. And that's just how OCD keeps you in a vicious different cycle. ERP will help you break this cycle. So, when I'm talking to a patient, I'll basically explain it to them like this. ERP means like you're gonna be gradually facing the thoughts, images, or situations that trigger your anxiety. And this is the exposure part. The response prevention part is where I will help you resist doing any rituals or compulsions afterwards that temporarily reduce your anxiety so that in the longer run, your body can send messages back to your brain telling you that you are safe. It's not about throwing you into your worst possible fears. It's done in a graded, structured, and collaborative way. The two of us will together create a hierarchy and we'll start from the easiest to the hardest triggers. We will only move up the ladder as long as you are comfortable with the lowest possible step. We're going to start from the bottom and build tolerance step by step. We're going to take it at a pace that you are comfortable with. It's important to build rapport with the client so that the client can basically trust you with this process. Clients should know that anxiety will definitely rise initially, and that's not a failure, it's actually expected. If they stay with it long enough without doing the ritual or compulsion, the anxiety will naturally go down on its own. The brain is basically learning a new rule that I can handle this without any compulsions, that nothing bad is happening even if I'm having these thoughts again and again. I am feeling anxious, but after the anxiety reaches its peak, it is coming down. I also normalize everything that they come up with. So, for example, a client might often fear that what if my anxiety never comes down? And that is not a realistic thing, right? So explain to them gently that anxiety will peak. Yes, it will be scary, but it will definitely come down and it will come down naturally. What they do need to do is develop the patience and stay with it in that moment. It is also important to remember that in that moment they're physically safe. Nothing bad is happening to them in the therapeutic setting. Anxiety will come and anxiety will go. They may also say that what if I can't resist my compulsion? And that's also fine. We have to assure them that we can start by delaying it, shortening it, and then moving towards a full blown prevention. We have to take it step by step at a pace that our client is comfortable with. I remind them that ERP is a learning process and it's not a test of willpower. We are teaching their brain that their thoughts are not dangerous and they don't need any neutralizing. We just have to teach them that thoughts are just thoughts. They will come, and they will go. We also have to address their magical thinking and make sure they understand that their thoughts cannot really create any actual difference in the real world. You have to keep on reminding them that it's okay, it's a process, and we'll go step by step. Finally, I tell them that the progress can look slow and uncomfortable at first, but that discomfort is actually a sign that they're in the right zone for change. And any change can come only if they step out of that comfort zone. Over time, as they keep practicing, obsessions will gently lose their intensity, compulsions will reduce, and their daily functioning will improve. So, overall, the key takeaways that you should communicate to your patient is that ERP is safe, it's evidence based, and it's a gold standard treatment for OCD. They need to know that anxiety is expected, but it is temporary. It will subside naturally without any outside interventions. Each exposure is a small step towards long term freedom from rituals, and success will depend on gradual, repeated practice rather than perfection. And I always end on a hopeful note by saying that ERP doesn't mean you stop feeling anxiety altogether. It means anxiety stops controlling what you do. And that's the message that we want clients to internalize before they even begin their first exposure. So I hope these points help and you can use them in your practice when you are dealing with patients who have OCD. Thank you.